Among so-called developed countries, it is America that is the most dangerous place to be sick, the most dangerous place to be pregnant, the most dangerous place to be gay, the most dangerous place to be old, and one of the most dangerous places to be disabled. That's why people all across the country are organizing for Medicare for all, or federal, universal, single payer, and why over 70% of the population, regardless of political affiliation, supports abolishing the private healthcare industry. Right now, many people rely on their workplaces to provide them with health insurance. These plans cost employees thousands of dollars a year in garnished wages and reduced wages, and they usually provide bad coverage with high deductibles. Instead of having a bunch of private insurers with their fragmented customer bases, each seeking to avoid taking care of unprofitable sick people, we can have one publicly owned, publicly funded insurer, a single payer, with a legislated mandate to cover in full all care for all people. What's more than that, once the federal actor bears the costs of providing care and the risks and costs of not providing for care, it can finally be used as a tool for realizing health justice. Health isn't just what happens inside a clinic or inside a hospital or inside a doctor's office. It's 1,000 components of our daily lives which intersect to drive our health outcomes. If your people are suffering because they don't have a place to live, or the places to live are unsafe, then housing is healthcare. And you build better, safer housing to bring healthcare costs down. If your people are suffering because they don't have access to healthy food to eat, then food is healthcare, and you provide them with affordable food options to bring healthcare costs down. Suddenly, the government is incentivized to take better care of its people because it makes the cost of healthcare less in the long term. Prevention of sickness, prevention of chronic disease is always cheaper than treating one. A single payer is not the goal, right? It's not a sufficient goal, it's just a tool, an important tool. Health justice is the goal. And when we fight for health justice, we all fight side by side because economic justice is health justice. Environmental justice is health justice. Reproductive justice for those who want to reproduce and those who don't, that's health justice. And justice for Black lives, justice for brown lives, justice for trans lives, justice for immigrants, justice for people in prisons, and the well-being of all people, regardless of age, gender, race, or creed, that's health justice.